Hello and welcome to the Canada News with your host Bharara. Now let's have a look on the headlines. Ontario mandating vaccine policies at all long-term care homes. Toronto Mayor John Tory during a pop-up clinic at the Brigade and Technical Institute said children 12 years old of age or older who go to school and their family members can take the dose of COVID-19 vaccine at any time. Newfoundland and Labrador Health Officer Rosen Xavier said 7 new cases of coronavirus were recorded in the province. Now news in detail. All Ontario long-term care homes will be required to have COVID-19 vaccination policies in the place for staff, the Ministry of Long-Term Care announced. The new policies will provide staff with 3 options. They can either provide proof of vaccination, proof of a valid medical exemption for the shot, or be required to take an educational course about the benefits of the approved vaccines. And the risk of not being vaccinated, Ontario will become the first province in Canada to make such a policy mandatory. The Ontario Long-Term Care Association said the vast majority of long-term care staff have embraced vaccination to protect their residents. For those without medical issues who are still reluctant, a mandatory education program will be helpful to correct misinformation and alleviate their concerns. Toronto Mayor John Tory during a pop-up clinic at the Danforth Collegiate and Technical Institute, children 12 years of age or older who go to school and their family members can take the dose of COVID-19 vaccine at any time. He also said that the city health partners will launch 50 more vaccine clinics in the coming days.
It's a good news story, all good news, because we're really making great progress on vaccinations. But the good news when it comes to people 12 to 17 is that 30% of them, 30% so far, and it just started a week or two ago, 48,000 kids of that age have been vaccinated already. But this clinic here, run by the Toronto East Health Partners, led by the Michael Garron Hospital, which has done such a great job throughout the pandemic, this clinic is meant not only for people who are of that age, but it's focused on people who might be students here or at some of the neighboring schools in the East End. And I'm just here to really show my support for the fact that we're trying to get those younger people vaccinated as soon as possible, and to show my support for the Toronto East Health Partners who are putting this on. A lot of people working very hard today on a Saturday to get other people vaccinated. So we're encouraging people to come out. If you're 12 years old or older, and that goes all the way up, you can come out here and get vaccinated. There are walk-ups that are welcome, and there's a great team of people here to make it a comfortable experience for you. We're making progress as a city, well over 2 million vaccinations given now, but we've still got to keep going, because the higher up we get it, the more we're going to get close to that day when we can start to open things up across the city. And so people have to come out. If you've done it yourself and you know somebody who hasn't, then maybe you could give them a hand getting vaccinated. And I want to make sure I get this right here now. We have a text capacity now to answer questions and help people get booked. And if you text the word vaccine to 1-833-750-0888, there's all kinds of information there about where you can get vaccinated, because weekends are a good time to do this. People are working during the week, they're busy with the kids virtually learning, which hopefully will maybe come to an end as well and kids can get back to school, but they're busy doing that sort of thing. But a weekend is a good time, and there are clinics, 51 over the course of the weekend, being put on by different people, so there really is lots of opportunity to get vaccinated. I should tell you another number here is the kids 16 to 19, teenagers 16 to 19 have done a fantastic job, and 52% of them are vaccinated already. So we just want to get the rest of it done. So there's 30% of the 12 to 17 year olds, which means we got 70 to go, and there's 52% of the slightly older teenagers, and it means we've got about a half of them left to do as well. So please come out over the weekend, please get vaccinated. Vaccinations and the good news on most of the other health numbers are the things that are going to take us to the brighter days and to the summer that we're looking forward to, and to patios being open, and to stores being more open, and generally just getting back to life as normal. So we want to work hard at that.
Newfoundland and Labrador Health Officer Rosen Xavier said 7 new cases of coronavirus were recorded in the province. He said that these cases were found positive due to close contact. He also said that there were 1,309 positive cases in the province.
We are walking towards the 4th wave in Alberta, especially with the very fast reopenings that we are doing right now, and with B1617 variant that is present here already. Variants emerged basically in places where there was high level of cases and high level of spreads, like in UK, in US, in Brazil, now in India. So we don't have such a high level of spread here yet. So probably we didn't generate our homegrown variants yet here, but that's why. So they come from abroad. They come because people are traveling. By such an event as Stampede, when people come from other provinces and come from other countries, then there is a possibility of bringing new variants here, and it's also possible to mix variants or to mix cases.
During the corona pandemic, where every section is facing challenges, there are social workers and volunteers helping to meet these challenges during this time. 900 volunteers from the Bike Brigade are also assisting Toronto residents by providing them food and other necessities during the pandemic.
Okay, we've got one large for you.
Thank you.
Okay.
People need help, and you can't help them staying at home. You can't help them behind a keyboard. You can't help them just sitting on your couch.
There you go. Awesome. Have a good ride.
Thanks so much.
It started because of the pandemic.
When you know that your time and effort can be better spent helping other people, how can you say no? Like, how can you?
How are you today?
Good, thanks. How you doing?
I will see you. Ride safe.
So my first ride for the Brigade was April 4th of 2020, and I remember that because it was 3 days after my parents tested positive for COVID-19. Those early days were so scary, they were so paralyzing, and I needed to do something with that paralyzing fear. I wanted to do something to feel like I had a little bit of control. I'm just kind of like sitting at home and seeing the scary numbers and seeing the events unfolding. I felt like there had to be something that I could do to kind of help out.
I've got lots of eggs. What do we need?
So I signed up for the Brigade and I was on a ride 3 days later. It's lessened a lot of the fear that I have around COVID, knowing that my community is here for me and that I can be here for the community. And it's been really good for my sense of humanity and my hope.
One large.
Thank you.
Have a good ride.
You can do that while you're waiting.
Oh, perfect. Okay, cool.
At the beginning of the pandemic, I was basically heartbroken because I lost my job that I was about to start, and I got let go from the job that I had been working.
We don't happen to have any like pedal wrenches, do we?
Oh, Danielle will.
Yeah?
Like, nobody ever asked us for tools, but you're here.
I swear I didn't jinx it. I joined the Bike Brigade because it seemed like they were doing something that if I wasn't so lucky, I might need someone to deliver food to my door. And so I thought that it was important enough for me to get out there and just get on my bike.
It feels like these threads are stripped, my friend.
There was one drop I did where someone needed just like a sweater and a bottle of laundry detergent dropped to their house.
The situation in COVID-19 in the province of Manitoba remains worrisome. Events during the third mandate wave in Canada, the number of ICU patients in Manitoba continues to rise and the death roll is staggering every day, even as Manitoba continues to streamline the vaccination process.
There have been a few patients that, even at death's door and on their deathbeds, are in denial. There's this idea that we are somehow colluding with a conspiracy that this virus is not real.
The makeup of the community is one that is self-reliant and believe that the less involvement you have with the government, the better off you are.
With the kind of second wave that we had and this delayed onset, as you point out, of the third wave, how could we have delayed action?
Jagmeet Singh, Bharara, leader of Canada's Federal New Democratic Party, has apologized after a video surfaced showing him violating corona sanctions. A 45-second video shows a masked getting out of a car and grabbing another masked man. The other person in the video has been identified as Tarunveer Dhaliwal, who hails from NCDP, the leader's brother Ratan Singh, a member of the Ontario Provincial Parliament. He is said to be an executive assistant. In response to an email from the Jagmeet, he said he was sorry for what he had done. Like most Canadians, he said, I did my best to follow public health advice. Coming back from an event, I did not enough to follow the corona rules, which I regret. I will do my best to keep my family, my community and all Canadians safe, Jagmeet said. We cannot disappoint our guards. Police are searching for a suspect who shot and killed 25-year-old man at a Mississauga restaurant and injured his father, mother, brother and an employee. Police are asking people to help identify the suspect. Emergency personnel were called to Plaza after the incident at 7:19 p.m. in the Colgate and Ellen Erin Drive area. An identified man entered the restaurant and opened fire on staff. Police said the bullets hit the 56-year-old owner, his 44-year-old wife, two boys aged 22 and 25 and the 50-year-old employee. Police said the owner's 25-year-old son was pronounced dead on the spot. The rest of the injured were taken to trauma centers where their condition is said to be stable. A surveillance video shows the suspect standing outside the restaurant. After a few seconds, he does not show up. Police said the suspect may have gone inside the restaurant at that moment and opened fire on people. The suspect was wearing a hooded sweatshirt and a surgical mask over his face. The suspect was also seen running away from the restaurant after the incident. The coronavirus has had profound effect on the people around the world and countless people have lost their jobs because of it. In Canada, the situation is even worse. People are worried about how to save themselves in this dire economic situation. Of course, the government is making many big claims to help the people, but under the circumstances, these actions are not enough.
For me to pinpoint what's going wrong, I need to have feedback, and not hearing back is just compounding the problem. One big struggle during COVID times is networking. Everyone says that you have to meet people, you have to network, but in these times, nobody's willing to meet you. Nobody is as approachable as they used to be back in the day.
Of course, the market is also big, but there are only few candidates that would be chosen. It really depends on the industry that they're actually applying for.
So at the very least, if you apply for a role, you should get an email back. I'm sorry to say that isn't always the case, and I think that that's what a lot of applicants are seeing today. It does go on, I'll be honest with you, it does. I don't think it is probably as much as people may think.
It's very challenging mentally when you apply for jobs and you don't hear back. I have a family, I have 2 children, and I have bills to pay. Right now I'm thankful that there is CRB, but once this finishes in September, I don't know what I will do.
We tend to be looking at just the physical impact of COVID. What we tend not to pay attention to is the psychological impact of COVID. And that's all tied to the consequential pieces of it, right? Like the inability to socialize, the inability to work. All those things that are generally helpful are going to make us more depressed and more anxious.
Various cases remain a concern in Canada, although their numbers are declining, but this does not mean that their spread is limited. Dr. Gasprovis also warned of the growing danger of the new variants of the COVID and said the sanctions could be tightened if conditions worsened.
Dr. Fitzgerald is taking some well-deserved time off this weekend, and she will be back for the regular briefing on Wednesday, as will the ASL interpreters. Since the media advisory yesterday, we have 7 new confirmed cases of COVID-19 in our province. In the Eastern Health Region, we have 1 male over the age of 70 and 1 female over the age of 70. These cases are close contacts of a previous known case and are connected to the cluster in Central Health Region. In the Central Health Region, we have 1 female under the age of 20, and this case is a close contact of a previously known case and is connected to the cluster in the Central Health Region. In the Western Health Region, we have 3 new cases in females under the age of 20 years of age and 1 female between 20 and 39 years of age. These cases are close contacts of a previous known case. There have been 3 new recoveries in Central Health, leaving 104 active cases in the province. Our current case count is 1,309. 3 people are in hospital due to COVID-19, and 146,081 people have been tested in our province to date. The investigation into the cluster of cases in the Central Health Region is ongoing. As of now, there are 64 confirmed cases associated with this cluster and 1 probable case for a total of 64 cases That's 63 confirmed cases and 1 probable case. The source of infection remains under investigation. We have a cluster in the Western Health Region, in the St. George's, Stephenville, Port-au-Port area. We call this briefing today because of this emerging COVID-19 cluster in St. George, Stephenville, and the Port-au-Port area. We now have 11 confirmed cases and 3 presumptive cases in this region without an identified source. Effective 4 p.m. today, we are moving communities in this area in the Bay St. George region on the west side of the Trans-Canada Highway to Alert Level 4. This includes the towns of St. George's, Stephenville Crossing, Stephenville, Port-au-Port East, and all towns on the Port-au-Port Peninsula. This also includes communities along routes 460, 461, 462, 463, and 490. In terms of Alert Level 4, to remind you, in terms of public spaces and gatherings, work from home work from home where possible. Stay within your household bubble whenever you are not at work or school. You can expand your bubble by a small amount to connect with immediate family members when necessary, bring in caregivers, or to support isolated people. Gatherings are not permitted except for religious and cultural ceremonies. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to no more than 10 people, including the officiant, and physical distancing must be respected. Public visitations and wakes are prohibited. In terms of outdoor recreational activities in Level 4, outdoor playgrounds and equipment can be used where operators allow. Gym and fitness facilities, yoga studios, swimming pools, tennis and squash facilities, arenas, and dance studios are closed. Group and team sports, arts and recreational activities are suspended. Performance spaces are closed. In terms of businesses and services at Alert Level 4, childcare services can operate at full capacity. Retail stores can open at 50% capacity and with physical distancing.
The Canadian government lowered the national flag in half to pay tribute to 215 children found dead. The bodies of the children were found last week at a former boarding school in Kamloops. The Prime Minister Justin Trudeau tweeted on Sunday in honor of the 215 children who were killed at the former Kamloops residential school. For all the Indigenous children who have never made it home and for the survivors and their families, I have asked them to lower the Peace Tower flag at half-mast on all the federal buildings in the country.
We're going to most likely be bringing them home, which means potentially unearthing them and going through and identifying them and then seeing which community they belong to. So that's going to be so hard and so horrendous.
I felt grief, and I felt a little bit angry as well, and I'm not an angry person by nature. These children's hurt is gone. Their pain is gone. They're at peace. This is now about what we do to remember this moment, but also how do we go forward from here?
We're still in the 4 days of mourning for a lot of Indigenous families, so we don't need to see action tomorrow. We need to see support.
We need to recognize that this is an issue that needs to be really acknowledged and not just written down on paper.
Canada will receive 2.9 million COVID-19 vaccine doses this week. All of this has been made possible by the increase in deliveries by Pfizer and BioNTech in May. The two pharmaceutical companies delivered 2.1 million shots a week, but in the week starting Monday, both companies are increasing these doses to 2.4 million per week. The federal government says it will also receive 5 lakh shots from the Moderna this week. The company will deliver these doses in 2 separate batches. The first batch will arrive in the middle of the week, while the second batch will arrive by next weekend. Doses will be distributed to provinces and territories from next week. The government also expects to receive 1 million more doses of the Oxford AstraZeneca vaccine by the end of June. But the delivery schedule has not yet been confirmed. The 3 lakh shots delivered by Johnson & Johnson in April have not been confirmed. The arrival of Pfizer, BioNTech and Moderna shots was confirmed when Health Canada on Saturday extended the expiration date of thousands of doses of AstraZeneca by a month. The injection, which is set to expire on Monday, can now be used until July 1st, according to Health Canada's news guidelines. So that's all we have in this bulletin. Thanks for watching. Stay tuned for more updated news.